Hello and welcome to Emergency Insights. I'm your host, Dr. James Carter. Today, we're discussing a condition that remains elusive yet potentially life-threatening, acute myocarditis. Joining us is Dr. Sarah Lynn, a cardiologist and researcher specializing in inflammatory heart disease. Dr. Lynn, thank you for being here.
Thank you, Dr. Carter. It's a pleasure to join you.
Let's start with the basics. What exactly is acute myocarditis?
Acute myocarditis is an inflammatory disease of the heart muscle, or myocardium. It's characterized by lymphocytic infiltration and myocyte necrosis. While it's relatively uncommon, it can be serious and even fatal, especially in young individuals. The presentation is often nonspecific, which complicates diagnosis and management.
What are the typical causes of this condition?
In developed countries, viral infections are the most common cause. Group B Coxsackie virus is the most frequently identified pathogen. Other culprits include influenza, adenovirus, herpes simplex, and HIV. There are also non-viral infectious agents like Borrelia burgdorferi, which causes Lyme disease, and Trypanosoma cruzi, responsible for Chagas disease. Beyond infections, myocarditis can result from drug hypersensitivity, toxins, and autoimmune diseases like lupus or sarcoidosis. And still, many cases remain idiopathic.
Interesting. Given such a wide range of causes, what does the clinical picture usually look like?
Patients often present with nonspecific symptoms such as fever, malaise, muscle aches, and joint pain. About 35% report chest discomfort. In more severe cases, patients may develop fulminant heart failure with dyspnea, orthopnea, palpitations, and peripheral edema. On physical exam, you might detect an S3 gallop, pulmonary rales, or signs of right heart strain. Occasionally, life-threatening arrhythmias or complete AV block can occur.
Those symptoms overlap with many other cardiac and systemic conditions. So how do we go about diagnosing myocarditis?
Diagnosis is indeed challenging. There's no single definitive test that's sensitive and specific. Clinicians should suspect myocarditis in young patients presenting with new-onset heart failure or signs mimicking myocardial infarction. Cardiac enzymes like troponins may be elevated, ESR can be high in up to 60% of cases, and eosinophilia might suggest drug-induced hypersensitivity. Routine workup should include blood cultures, viral serologies, and autoimmune markers. Imaging is crucial. Echocardiography is especially useful for detecting ventricular dysfunction and associated findings like pericardial effusion. Cardiac MRI offers additional value by identifying inflammation and fibrosis. The gold standard remains endomyocardial biopsy, but due to its invasiveness and low sensitivity, it's not routinely performed.
You mentioned supportive care is the cornerstone of treatment. Can you elaborate on that?
Yes, management focuses on alleviating heart failure symptoms. That includes diuretics, ACE inhibitors, and vasodilators like nitroglycerin. In severe cases, especially with cardiogenic shock, mechanical circulatory support such as a ventricular assist device may be necessary. Bed rest during the viremic phase is advised, particularly important for young athletes where sudden cardiac death can occur.
Immunosuppression might be beneficial in cases linked to autoimmune disease, but it's not recommended for standard treatment unless there's clear evidence of immune-mediated pathology. Let's talk outcomes. What's the prognosis for these patients?
It varies. Many patients recover completely, especially those with mild disease. However, fulminant cases can lead to severe complications, including dilated cardiomyopathy and death. Early recognition and appropriate supportive management are critical to improving outcomes.
Before we wrap up, what's one takeaway you'd like to leave with our listeners?
Stay vigilant. Acute myocarditis may masquerade as a benign viral illness or even an acute MI. In young patients with new-onset cardiac symptoms, especially if they follow a recent viral illness, keep myocarditis on your differential. Early suspicion can be life-saving.
Wise advice. Dr. Lynn, thank you for sharing your insights on this challenging and often under-recognized condition.
Thank you, Dr. Carter. It was a pleasure.
And thank you to all our listeners around the world. You've been listening to Emergency Insights. Stay sharp, stay safe, and join us next time as we explore more key topics in frontline medicine.